Hello, everyone, and thank you for joining us for today's webinar. I'm Leslie Bebko, your host from Bioprocess Online and Life Science Connect. With me today, I have Yeon-Chan Lin, Director of Formulation Development from Samsung Biologics, here to talk to you about formulation considerations for the development of high-concentration biopharmaceuticals. After his presentation, we'll be holding a Q&A session. Feel free to submit questions as we go along. We'll get to a few during the Q&A, and any that we can't get to, we'll follow up on after the event. If you run into any issues, please try refreshing your browser first, and if you need additional assistance, submit a question via the Q&A. Finally, this webinar will be available for on-demand viewing. You'll receive a link via email as soon as that's available. With all that said, I'm going to turn it over to Yeon-Chan to get us started.
Thank you for a brief introduction. Hello, my name is Yeon-Chan. I'm head of Formulation Development Group in Samsung Biologics. Today, I would like to present to you on the factors to be considered for the development of high-concentration biopharmaceuticals. But before we discuss our primary agenda, I would like to briefly introduce our formulation development process in Samsung Biologics CDO service. Our CDO has performed for over 60 projects since 2018, and among them, around 35 programs have been approved by FDA, EMA, and MFDS. 60% of our program are simple monoclonal antibodies, including high concentration, and other 40% are complex proteins like multispecific antibodies, fusion proteins, or synthetic peptides. We have cutting-edge high-throughput screening system, allowing us to provide optimal formulation condition to our client within 3.5 months for simple monoclonal antibody below 100 mg per ml, or 4 months for complex proteins as well as monoclonal antibody over 100 mg per ml. We have achieved 150 mg per ml monoclonal antibody with less than 7 centipoise with our optimized formulation conditions. Now, let us move on our main topic, high concentration formulation development. The market trend for the approvals and the release of the drug product over 100 mg per ml have been increasing rapidly, in particular for monoclonal antibodies. So why do we need to make biopharmaceutical drug product at higher concentrations? What are the advantages of preparing formulation over 100 mg per ml? High concentration formulations open the door to further options, such as self-administration therapies, which lead to improved convenience and compliance. And high concentration formulation also save the cost in terms of storage and shipping, as the high concentration drug product requires lower volume. Hence, smaller vials or syringes are required compared to lower concentration drugs. Despite this great benefit, challenges in actually developing high concentration formulations must be overcome. And these challenges, which have been highly indicated in a variety of publications will be outlined in this webinar. It is important and also difficult to maintain stability while establishing an appropriate concentration of 100 to 200 mg per ml, as different unwanted effects could arise. One very common one that is observed at higher protein concentration during the UFDF process is the Donan effect and volume exclusion effect. This will often result in changes in pH and excipient level. At concentration greater than 100 mg per ml, there also can be molecular stability issues. Here, we expected that at higher concentrations, aggregation is more likely to happen while also increasing viscosity. Additionally, there are process challenges at high concentrations which may impact operations such as filtration and filling. Therefore, It is important to be able to characterize these changes to be able to adjust them accordingly. Some concentrations for formulating at high concentration also are applicable for formulating biopharmaceuticals at any other concentration. For instance, it is imperative to identify conditions that support the chemical, physical, colloidal, and solubility properties in any cases. Here are some examples of how formulation pH and buffer system can have a profound impact on the chemical, physical, colloidal, and solubility behavior. And so, as HiCon, Samsung Biologics high concentration formulation platform to give a high concentration formulation condition to our client. As HiCon, during its journey to delivering the optimized high concentration formulation, integrates all the process and analyzing capabilities to ensure the critical formulation challenges such as Donan effect, aggregation, viscosity issues are addressed. We have as our very step of as a HiCon, what is called the concentration gate check. The concentration gate check assesses whether obtaining a concentration higher than that of the target in advance for the diafiltration buffer is feasible, leading to variable processes. If the gate check evaluation indicates that attaining the target concentration is not feasible, then a non-platform approach will have to be taken, such as including stabilizing and or viscosity reducing agent into the UFDF system. Therefore, it is important to perform the concentration gate check only during formulation development, so that if adjustments to the strategy are required, then alternative strategy can be implemented only in the development process. So here we will look at the case study for high concentration formulation gate check and development. As we just discussed, one of the critical steps for attaining a stable high concentration formulation to have the ability to first attain the target concentration. Once this is completed, the concentration material needs to have sufficient short-term stability at room temperature to enable processing hold times. In this map example, it is clear the selected buffer at an excess concentration of up to 266 mg per ml exhibit good room temperature hold time stability. As I mentioned earlier, during the UFDF processing of high concentration protein formulations, there are often changes observed, such as pH changes. From a formulation perspective, achieving the accurate target pH is very critical attribute for the overall stability of the formulation. Therefore, after identifying the optimal pH and buffer during formulation development, it is important to perform TFF characterizations. These characterization studies allow the identification of the appropriate buffer and pH so that at the end of the UFDF process, the final target pH can be achieved. As can be seen in the slide, there is a significant pH changes with increasing protein concentration. We can adjust the pH of the DF buffer to target the final formulation pH. In the case of here in the slide, concentrating up to 250 mg per ml, the pH changes by 0.51 pH unit from the pH of the diafiltration buffer. The strategy for this case was to adjust the pH of the initial diafiltration buffer by 0.51 pH units so that the final target pH was achieved at the end of the UFDS process. In addition to identifying an optimal pH and buffer system, it is also critical to select the most suitable excipient for the formulation. Excipient can impact the chemical stability as well as the physical stability of the protein. In high concentration formulations, physical stability can be a major concern. There are numerous examples of excipients improving the conformation, colloidal, and frozen stability of protein. Excipient can also largely impact the solubility and viscosity behavior of high concentration formulations. Another impact that a different excipient may have on the stability of a high concentration protein formulation, it is their influence on the visual appearance of the formulations. In this example, we compared two different formulations, one that is slightly opalescence and the other that is clear. The different excipient leading to different impact is likely due to an influence of the different excipient on the physical stability of the protein. This slide demonstrates the impact of the different excipient on the thermally induced aggregation at concentration greater than 200 mg per ml. This result highlights that at high concentration in particular, the choice of excipient can have a significant impact on the stability of the formulation. Viscosity is another critical attribute for high concentration formulations. Viscosity can impact the DS and DP filling process as well as the injectability of the formulation. Therefore, viscosity is an important attribute to control. As can be seen in this slide, the composition of the formulation can largely impact the viscosity of the formulation. In this example, at the highest concentration measured, we can observe the difference of up to 9.6 centipoise between the two formulations. Another analytical considerations for establishing high concentration formulations is osmolarity. In this example, differences are observed between the measured osmolarity from different type of osmolarity instrument, freezing point depression and vapor pressure depression osmometers. In this example, comparing the measured osmolarities to the theoretical osmolarity, it appears that the result from the vapor pressure type osmometer is closer to the theoretical values as compared to the result from the freezing point type osmometer. Additionally, our studies suggest that the formulation composition can also impact the variability in the osmolarity result at high protein concentration. The demand for high concentration biopharmaceutical product is on a rapid rise. However, there are numerous challenges associated with formulating complex biomolecules at high concentration. This is why we believe that the stepwise and rational approach to development is pivotal in success developing a high robust formulation ensure the formulating are achieved. Evaluating the feasibility of attaining target concentration, identify an optimal surfactant and pH buffer system for physical, colloidal, and chemical stability. Screen numerous excipient type and combinations to minimize degradation and viscosity. So, thank you for joining our webinar today. This was Chang Lim from Formulation Development Group in Samsung Biologics. If you wish to explore more about our service or discuss with us about your developmental journey, please participate in our survey and tell us your interested area. Thank you.
Thank you so much. Great presentation. As Young Chen said, we do have a few questions for you as well. If you wouldn't mind answering those right now, those are to the right-hand side of your screen. And then we'll get to our audience questions. If you haven't submitted those, you can also do so right now. Any that we can't get to, we will follow up on with you after the event. So right to our first question, would it be all right to use centrifugal tubes instead of TFF to concentrate the material and check the pH shift considering the amount of material and man hours?
Yeah, we did study the difference between centrifugal tube and TFF and found both had differing effect on the pH shift at certain concentrations. Therefore, since the real concentration process will be performed with the TFF process, TFF membrane, K-check should be performed with the TFF system.
Great. Thank you so much. I believe we have time for just one more question. How do we know what the more appropriate method for checking osmolality would be?
Yeah, thank you for a good question. Actually, it is hard to know which one is more accurate. Therefore, finding a range that can satisfy both freezing point type and vapor pressure type could be an alternative to get final formulation composition.
All right, thank you so much. Unfortunately, that is all the time that we have with Yan Chan today. If we didn't get to your question, we will be following up with you afterwards. Also, we do have some related content available for you at the bottom center of your screen. You can view and download it from there. Thank you so much for joining us today, and we hope to see you again soon.